Really excited again to share space to talk about sort of leadership and engagement with BIPOCs, as well as the the intersecting movements, right? And the ways in which we can mobilize the lived experiences of communities of color within the harm reduction movement. So I'm so excited. And now I'm going to throw it over to our amazing presenters. Regina?
Well, I'm on mute. Let's start there. But I'm Regina Musa. I currently work at UNC Injury Prevention Research Center. I work on, we are building a network, which was 7 states when it originally started. It's with community-based organizations and health departments, and it's just a skill sharing network for practitioners. We try to add in the voices of the participants, but it got a little hefty during COVID, so we are now able to travel. We also added 5 more states, and I am one of the regional consultants with the drug user health team, and I will pass it to Takisha.
Hello, my name is Takisha Nunez. I work for the University of Kentucky, the CURT program, Target 4. I am the team lead for here in Louisville, Kentucky, but I also cover 7 other counties. So in Louisville, we had the first syringe exchange that was formed in Kentucky back in 2015. And I'm in charge of helping to expand services in the community. So outside of the brick and mortar location, as well as working with some of the other surrounding smaller counties with getting syringe exchange services started. As Regina said, with COVID, things kind of slowed down, but we were able to continue services. So just excited to be in the room with everyone. And I will throw it to Rachel.
All right, thank you, Takeisha. My name is Rachel Cabugao. I work for the San Francisco Department of Public Health. I currently do harm reduction capacity building work, as well as conduct street-based outreach, syringe access services, and opioid overdose recognition and response trainings. I also have been working heavily in harm reduction for about almost 10 years now. And I'm really excited to be in community with harm reductionists of color. So I'm just going to pop this over to Teresa.
Thanks, Rachel. So hey, everyone. My name is Teresa Springer. I work at Wellness Services in Flint, Michigan. We are traditionally, I'm the director of programs there. I started out as an intern. I did my internship there and kind of had a lot of roles there. So I've been a prevention specialist. I've done outreach. I do a lot of training. I still do a lot of training, capacity building. We are heavy into harm reduction. We operate a SSP. We do naloxone education and whatnot, and we're steadily building out those programs. So we're an AIDS service organization or HIV organization. So traditionally, HIV organizations were the original harm reduction organizations. And so it was kind of easy just to kind of move into harm reduction. I'm really happy to be working with the team that I work with at Wellness. Brian, Anwar, and Yashika run our programs, and they are amazing. I support them by trying my best to get them money to do their thing. And yeah, just do that. And then in general, my workshops go around decentering whiteness in medical and social work spaces. And by decentering whiteness, we center equity, we center people, right? And so we know that these systems were built on this white foundation, and we're just no, we need to get rid of that, and we need to center humans instead of centering whiteness. But yeah, I think I'm the last one to go, so I digress.
Yeah, thank you all. So I'll just go ahead and get started with the questions. I'll pose it to anybody who wants to answer. What do racial equity and justice mean to you? Anybody who wants to take a stab at it?
I'll go. So racial justice, and what does racial justice and equity mean to me? Is that the question?
Racial equity and justice.
Racial equity and justice. I love the word equity because and a lot of times people think that we all need the same thing when we don't. We need what we individually need. And equity gives you what you need in that moment instead of just giving everybody like equal access. And I'm not saying don't give equal access. I'm saying give people what they need. And racial justice and equity is centering the voices that have not been centered historically. And so listening to people that have been historically excluded in conversations, like making sure they're at the table, making sure their voices are heard, making sure their needs are met. You know, like it's that old saying, nothing for us without us. I mean, we know a lot of times, a lot of decisions are made that go around racial justice and equity, or racial equity and justice. And those voices aren't in the room to speak up. And then like the plan comes out and it's just like, nobody asked for that. Like, and like, to put it plainly, like we love that Maya Angelou is on the quarter, but we didn't ask for that. Like, that's not the racial justice or that's not the equity that we wanted. We wanted real equity. We wanted programs. We wanted reparations. We wanted things like that, but y'all gave us a quarter. And it's just like, oh, woo. So yeah, that's what it means to me, like at the table.
And to kind of just piggyback on that, looking at, like she said, looking at what people need and understanding that those needs are very different. So working in Syringe Access Program here in Louisville, I've looked for years at why are we only seeing a majority white people? You know, I know that there are Black people and Hispanic people and Asian people and Indian people who are using drugs in our city. And we know that there is a huge drug issue, but the only people that we are servicing are primarily our white counterparts. So what does that look like? Are we supplying them with the things that they need? Is it an issue that instead of injecting, our participants are snorting or they are smoking? So why are we not providing that education around those things as well? Because we know that that's a public health issue. So looking at, yes, we have this drug user community, and yes, they have issues, but it goes beyond just the syringe, which is why a lot of our Black and brown people get frustrated about having a syringe exchange program, because they feel like, what are you doing to meet our needs? We understand that this is going on because of our white counterparts, and it's offensive.
I'll go a little bit off of that. I really appreciate both of what was said. I think it is so truthful. I think unintentionally harm reduction in the South, because that's all I'm familiar with, is the region and the state that I worked in, especially doing direct services. And what I'll tell you is that the access for, for me, like we're not meeting the needs of that community. We are not intentionally going into these communities and asking them what is needed. I think became hyper-focused on the opioid epidemic, which hit a target population. But then I have people that are overdosing as they leave jail for snorting in the Black community. And are we addressing this, like getting into those communities and doing exactly the same work that we've done historically with our white counterparts, and that's just building trust in these untrusting situations. But to speak to what I heard just a minute ago, as far as the point, like I know they were doing some housing, and like I was like, did anybody ask? Like, if we're going to do best practice around, you know, the work that we do and intentional work, then we need to be asking and going into these communities and actually allotting a lot. Like, I feel like that grant money should go specifically and intentionally into that community, and not with the expectations that we think should be happening, but with what they're telling us are their needs at that time. So that's just been my experience so far.
I just wanted to add on to basically what my colleagues on the panel have just basically illuminated. I come from a very urbanized area. I come from San Francisco. You know, I've just been doing needle exchange in the San Francisco Bay Area for years, and it is incredibly infuriating, like year after year, month after month, the programs that are centered around harm reduction are dedicated to white drug users and serve a very specific type of drug user. And it creates all of these unnecessary harmful politics in terms of accessibility towards certain drug users. Like some deserve, like some have more access to MAT or just basic medical care more than their POC counterparts, for example. And I just want to speak to that. What race, equity, and justice means to me is that, like, just acknowledging and highlighting the history of oppression, the war on drugs, how it's damaged so many communities of color who use drugs. And I just want to also name that, like, we should put BIPOC communities of color who use drugs as the forefront, as, they're the leaders, they're the pioneers, they're the innovators that are ultimately going to dismantle and eliminate the war on drugs. And maybe we can start seeing more equity across the board for all types of people who use drugs. So I just wanted to end that there.
Thank you all for those really brilliant answers that you all have provided with us. And I'm really sitting here trying to sort of streamline these things that you all have talked about, primarily around, one, what is the role of censoring voices, right? And prioritizing better service prevention, right? So this was primarily talked about with when we don't intentionally hit our targeted populations, or as Gina beautifully stated, right? The hyper prioritization of opioid use rather than addressing it from a polysubstance use standpoint, right? Or as you pointed out, Rachel, around the failure to address best practices, right, as it pertains to housing. And I want to also highlight, for me, that this calls into questions around what is the role of, if we fail to center communities of color, right, what actually gets lost within our harm reduction services? And so I'm really interested to hear, like, within your scope of work across different regions, right, from California to Michigan, or even in the South, as Takisha and Gina are specifically located, within your work, what would you say are some examples to make make harm reduction, right, as a movement, more BIPOC-centered and responsive to community needs?
I can do it. So the one thing that I think that would be very, would be just to take, like, some form of ownership when moving into those communities. So, like, let me be perfectly honest, when I did outreach and I went to, like, Durham, people are accessing, like, condoms, safe, whatever, that looks like, but how are we treating this individual wholly? Because I did linkage to care. So, like, where are the opportunities? I've had detox centers tell me that because a person was on meth or cocaine, it wasn't an immediate need. And so, like, we are dealing with using, period. And the substance, to me, definitely shouldn't be, like, the restriction. But I mean, historically, it's been like that, right? Like, crack is, like, the poor man's drug, and now meth, we're just gonna act like that's not happening, right? Because we're so hyper focused on the fentanyl getting mixed in, but the fentanyl is getting mixed in with all of the drugs. So, but we're just gonna focus on. So I'm grateful when I see the grants that are talking about polysubstance. I'm grateful to hear about the safer smoking supplies, because I believe, just like with the syringes, that's a great talking point, right? And, like, to start there and to build off of that, and to ask people now. There are some old school people that have shot drugs for years that are in the Black community in Cumberland County, and they will access services, but they're also not overdosing. I think they've had the same dealer since they started. And so it's not, it's not that they're not looking for any other services, they will engage, but to what extent is just to, like, grab supplies. So if we're gonna, like, heal people holistically, the whole person, then I think we need to do really intentional work around where we have those talking points, and allowing them to be participant led. You tell us, right? Like instead of us going in like, I have this great idea. I have a brilliant idea. And they're like, yeah, no. So I just feel like, yeah.
I feel like the core of harm reduction is meeting people where they are. And a lot of times when we are in the community, we're not doing that. Like Regina said, we're meeting people where we're at, or we're looking at it on what we think is best. In Kentucky, syringe exchanges can only be ran through health departments. So health departments without mobile units and places, things like that, to go to where the community is a barrier. Trying to get in and do street outreach so that people can build trust, because we know of that disproportionate trust with populations of color with institutes like health departments and law enforcement. So if we're not doing the work to actually meet them where they are, we're going to always continue to fail. And no matter how many programs or great ideas we have, they're going to fall on their face. Also addressing that, like Regina said, people have been injecting for years in the Black community. Sometimes that's a sore issue of where were these syringe exchanges when I was injecting, or when my father was injecting, my cousin, my brother, my mother, where were these services? And now since it's affected other, they're here. Do I really want to use them? So having those conversations where we can say, I understand that this is offensive, that it's happening now, but how can we use this to keep you safe? And what other supplies, now that they are looking to do other things like the smoking kits, how will that help your community? Does this make sense for you? And those community involvement boards and surveys, as antiquated as they may seem, are important because you're giving people a voice that they feel like they may not have.
Yeah, to build on that, you know, and I think maybe Regina, you said it, but like just admitting it, right? Like just saying it, like, yep, we really messed up the crack epidemic in the 80s. We really did not pay attention to it. We criminalized it. We gave people 20 years for a rock and 5 years for like an ounce of Coke. Like we really messed that up, and we want to do better moving forward. Because like, that's huge. Every space that I'm in, I hear that like, well, they ain't do nothing for us in the crack epidemic. And I'm like, yeah, no, they didn't. And like, you'll see people, or I'll hear people that try to justify it. Like, no, it's not a race issue. Like it's a race issue. It's all a race issue. It's all tied to race. Like, and people, they refuse to see it sometimes. And I think another thing that people refuse to see is that it's not just about the active user, like the person that's using the drugs. It's about the dealer too. Like, and when I say it's about the dealer, like there's this thing, and it really, like, it irked me. It was that kill your dealer thing. So it's love and justice for people that use drugs, but it's kill your dealer. Like, we dealing with the same people. Dealers are users too, like they use too. And like, they are our access points to the community. So why aren't we giving our dealers like some syringes and some pipes and like some smoke kits and stuff like that, and engaging with them instead of like criminalizing them? A lot of dealers are not doing it to like they're not malicious. They're not in their kitchen maliciously adding fentanyl to the supply. Usually they're getting the supply, it's already there, and they don't know. So why aren't we giving dealers fentanyl testing strips so they can say, hey, you know, I got this and this is what's in it? But we criminalize people. Where I'm from, I'm in the city of Flint, and that's like the little hub, and it's 67% Black. And that's where a lot of people come in. They go into the hub to access the drugs, and then they'll leave out. And so like, they get this love and stuff, but then we're just like, so like I don't know, but it's just, it's a point of contention for me that we don't have more conversations around that, because most of the dealers where I'm from are BIPOC identified, and we're not reaching them.
I'm gonna let Rachel jump in, but I just want to say I was working with somebody the other day, and what they specifically said was, I paid back my debt to society with probation and everything that was asked of me, and I still am not able to access services because of this check for selling drugs. So it's almost like what we've done is we've criminalized like the criminal to like, now what are the options? Like, tell me what the options are when I'm leaving jail and I can't access food stamps or housing, but you don't want me to be a drug dealer anymore. Come on now.
Mhm. You know, I have a follow-up question, and this was namely to Teresa, but I'm gonna wait. I'm gonna go ahead and let Rachel go ahead and answer that question. But I do have a burn and fire up question and follow up.
No, it's all good. I mean, I just wanted to echo the fact that, like, yeah, no, we should all have like a community-driven approach when it comes to collecting information about any of the communities that we're working with. I think it's important that, you know, we need to learn the wants, needs, and desires of communities before we go ahead and design and implement programs that are quote unquote to benefit them. And, you know, on top of like program design and planning and like building relationships with the community, you know, I also think that like people overly value quantitative data rather than qualitative data. And I find that there shouldn't be a lot of pressure around the CBOs and the people on the front lines to collect data and like hard points to justify things that are needs in the community. And I just want to ensure that, like, you know, when you're trying to build relationships with people, when you're trying to like implement any kind of like harm reduction program, it has to come from like the people of the community. It can't come from, you know, from people. You have to look at the community as your partner. You can't look at them as like, you know, your patient. It's a very interesting power dynamic, how government can be the gatekeeper to all resources. But again, I'm just gonna pass this off to like Mark and like keep the conversation going. And that's basically all I wanted to share about that.
No, this is a safe space to say however much you want, whenever you want. So I want to hold that to light. And I just also want to give note to folks that are going up in the chat with a lot of what you all are talking about, primarily folks saying that drug dealers are integral parts of mutual aid systems within communities. Lily also noted that that she heard that about dealers making COVID rapid tests available, right? And also Kelsey saying in the chat that dealers deserve the same services and often tell our outreach they want to know what's in their drugs too. They do care about knowing and hearing their voices. And that's so important. And just to affirm that, thank y'all for bringing these points up. But I have a question, and this is a follow-up, and then I'm gonna throw it back to Elika as well, but this was around policy, right? And Teresa acknowledging sort of the historical legacies of the war on drugs and other racialized drug policies that have disproportionately affected Black and Brown people. And what she noted was that, you know, it would be great to just hear and say, you know, we messed up, we effed up, and we want to do better. So I guess my question just is, what does that better look like? I think you all have kind of pivoted towards that, but what does that actually look like? And maybe that was pointed directly to Teresa.
Right. I was just like, am I supposed to talk? No, but like to me, I feel like we said it earlier.
Yeah.
Or maybe we even said it before we got like in the big space, but like inclusion, like listening to individuals that are doing the work, engaging individuals that are doing the work, and the people that are accessing the work that's being done, and then including them in meaningful opportunities to assist their communities, right? And so a lot of times, like, I don't know how to put it, but a lot of times, because like, I'm just like, I feel like I'm just like, here are my rants that I have, and here's the platter to serve them on. But I feel like a lot of times people will pull in big names from out of their city to come in and do work in a place that they've never been with people that they don't know. When it's people that exist in those networks that are willing to do the work that need the opportunity, that need the pay, that need the benefits, the PTO, the health insurance, they need that. But you'd rather pull somebody in from Florida or wherever than to hire somebody in your own backyard, or to like grab somebody that like stood out, that's accessing services. Like, man, like you always coming in, you always the one that's doing secondary exchange for everybody, you always the ones that's using your naloxone kit. Like we need you, like we need you more than just like as like a person that's accessing services. We need you on a higher scale. We would like to offer you money for your services, right? And then that's another thing, everybody want to give an incentive. Like pay people their worth, pay people with meaningful funds and opportunities, and stop giving people a $10 gas card for their labor. That's whack. And if you do that, you whack. And at least in my book, you are. I'm gonna digress because you know my rants can go on for a really long time.
No, I think you are laying the foundation here. And thank you for your insight. I appreciate all of y'all. Now I'm gonna throw it back to Elika. Thank you.
Yeah, of course. I mean, I appreciate everything that you all have been saying. And I think I'm going to shift the conversation a bit to talk about BIPOC harm reductionists specifically. And we've definitely been hinting on it with a couple of the points I already said. But just to open it up, since I know that you all come from health departments and SSPs, what can health departments do to support BIPOC harm reductionists? And how can harm reduction programs support BIPOC harm reductionists?
So I'll jump in first. What can health departments and agencies do to, to assist us? I think making sure that we have a seat at the table. A lot of times when you are dealing with Black and Brown people, we are kind of like that mid to low level management in a lot of spaces, making sure that it's not just the face that's there, that's seen readily in the, in the public, but it's also that person who's sitting at the table helping to make those decisions. We should be reflective of the community that we're trying to reach in a lot of ways. And if we don't have that representation, we have some issues. We're failing each other. I'm always excited when I'm able to work with Black women like myself. It helps me to grow and to learn. Same thing with my white counterparts, but it's just a different feeling when you know that you're supported, not just as a grunt worker, but also for the higher level knowledge that you have.
I just want to add to what Takisha said. So basically, it could be very isolating to work in bureaucracy that is incredibly white, specifically HIV prevention, even though we all know that most of the communities that are deeply impacted by this endemic work that we've done is people of color. And I think that for me, what's been helpful is the opportunity to know that there are other harm reductionists of color working within the same system and framework as I am. And it's really good to know that I have wells of resources now that I can tap into in terms of navigating the system in a way that's not only going to honor my values and beliefs in working in harm reduction, but also just keep opening the door for folks in the community into the policies, into the procedures, into the development of the programs that the health department is developing. But aside from that, I also think that providing if you're lucky enough to be in one of these seats, and if you have management that's white, that's I think what's also important is knowing what skills are valuable to illuminate what kind of perspective that I'm trying to show. My agenda ultimately is to uplift the voices of communities of color who use drugs. What are the skills that I need to know? Is it project management? Is it public speaking? Is it what are the technical skills? Because I'm kind of tired of hearing just learning about the soft skills, and I kind of want to learn the technical skills to get my point across, because I'm just constantly underestimated all the time for just the way that I look. And it makes me more, it just motivates me to like, what are the ways that these people can take me seriously? And like, what are the skills that I need to like practice in order to get my voice heard? I'm not just like some other seat on the table. Like I actually have a proactive voice in this.
I'm gonna just jump in and say something. And angry Black woman, you know, to continue to be seen as an angry Black or brown woman, especially as women when working in this field. And we have to speak up loudly a lot of times to make sure we're heard. Been in a lot of spaces where my white counterpart is a white male, and they say the exact same thing that I say. So when I say it a little louder, angry Black woman is how you can come across. And I think that is one of the things, eliminating that word, eliminating that thought when we are passionate about the things that we're passionate about.
I see some, I'm reading the chat. I'm just like reading this. Yes, folks saying speak on it. Don't hurt them.
I feel like, oh, sorry.
No, go ahead. Go ahead. Go ahead, Teresa.
No, I was just because like it's what Takisha said, Takisha, right? Now I got a cousin and her name's Takeisha. And so it's spelled similar. So like, you know how your brain bounce but like, even in that, like looking at your staff and who is in leadership positions and who is the populations you're serving and who are you having serve them, right? Because there's places that I've walked into that I've just been like, this is not for me. Like I would like to access services here. It seems like a nice space, but I see that you don't value Black women here. And I can't give you my services if I see you don't even value me enough to hire people like me, right? And so like in that, I gotta like step, and like it's unspoken. I don't go in there and tell them that, you know, I just leave and never come back. And they be like, you want to schedule another appointment? I'd be like, no, I'm not gonna answer that call. I'm gonna find me somewhere else to go that values people that look like me, specifically Black women. Because there ain't nothing like seeing a Black woman when you walk into a space. Like Black women make me feel so safe. I don't care. Like as soon as I see them, I'm just like, oh my God. Like, it's the best. And so like, I completely agree that it's good to have that like camaraderie. It's good to have that sisterhood. And it's just good for organizations to look at their staff, at their employees, and see who they represent and see it with a really good eye, and not just like well, we just hired the best person for the job. Like, are you even like putting it out there for people to apply for the position? Because don't nobody know about the position except for the people that work there. And so they sending it to their people, right? Because I'm gonna get my homegirl in. But like if I don't have access to BIPOC people, if they not my people, then who am I linking into these, right? And that goes back to equity. I digress again.
Yeah, no, y'all are all like, I'm getting goosebumps over here. I want to snap. And I'm also, might I say, just, you know, just thinking and reflecting on sort of my own lived experiences within this field, right? And I think a lot of what y'all are pointing to around, and this is the next question around organizational structure, right? So you all are talking about it, right? So what does it mean if your organization isn't reflective of the communities that are directly impacted, right? What might it mean to have an organization that has white directors, right? Or folks in higher management positions, and then your direct service providers, for example, are people who are of color, but are only outreach workers or peers, right? And this has been a common theme often within the harm reduction community and beyond, right? When we think about sort of the nonprofit industrial complex, right? And so what would you say, like how, and more recently, right, with thanks to spaces like the Racial Equity Collaborative for Drug User Health, we're sort of working to remove those, the barriers, right? How would you say, folks here, how would you say we challenge organizational structure, right? and ensure that BIPOC are holding higher positions within these respective orgs or within government spaces? How do we sort of work towards that?
I'll tell you a little of my experience. So because of my lived experience, I've been asked to sit at a lot of tables and share trauma over and over again. And, like lots of interviews, lots of panels, and lots of tokenism, right? Because far and in between that, you have a girl who is an ex-sex worker, ex-IV drug user, and she's Black, and she's able to speak and be presentable, correct? So like looking back, like, of course, I'm like, there's a part of it that I'm like, okay, it put me in places like, hold on, it's Rachel. Rachel said, if we're able to come to the table, right? I don't know when they invited me to the table and there was no longer like them asking me about my story, if they appreciated what I had to say, but I'm always honest. And I feel like, nothing changes if nothing changes, right? So like we're historically in this white, and it's like this white world, right? And especially here in North Carolina, and that says nothing about my white counterparts that are doing the work, that have been doing the work. It's just what it is, and it's been like that. And so I'm like, yeah, but we need to change it, right? And like the way that we change it is like we make sure that we're inclusive and we're not just hiring people with lived experience that, you know what I mean? Like, that's great, but like, are they a good employee, and are they able to like get into communities? Because I think one thing that I struggle with the most is watching these grants go to organizations that I don't believe can even access the community. But we see these data sheets come back, and like when I really get on my high horse, I'm like, walk me into that community, introduce me to who you met, and tell me how things have changed for those individuals. And but that's just me, and what do I know? But the structure, like we need to destructure the structure as it stands, right? Because historically, and we have been disenfranchised, we have been counted out. So like now everybody's like inclusion. So you hire like 2 people, but like what weight, what value, and are they able to, Mark touched on it, and that's one of my biggest problems with peer supports, because I feel like we work peer supports like they're social workers, and we pay them $14, if that, and so they meet with an individual for 15 minutes, and they do 45 minutes of notes so that they can bill Medicaid. But tell me where they can grow in that organization. Tell me how you go from being a peer, not a peer 2. Tell me how I end up in a leadership role. Like if you can tell me how to get to a leadership role, because I stopped asking for permission, and I was just like,
what's that? Were you able to find the person? I think it was.
Go ahead, Regina. Sorry about that.
Yeah, like that's my whole thing. And like, I won't, I'm doing work like with helping with trainings, but I told them I will not introduce you to anybody that cannot move any further than when you hire them. Because I think that is like, it's like running in place, right? It's like I'm on a treadmill. Like, how fair is that? And then to get into, and this has no reflection of where I am right now. I love UNC, which I never thought I'd say, especially since research is involved, but I love where I work. I love who I work with. And that being said, like there are opportunities, but when I see somebody get hired and that's the whole opportunity, that's really like, it's, I don't know. I was like, we need to start a labor force for peer supports. I mean, because everybody's a peer support. There's not even enough jobs, but even still, like, it's like giving them a gas card almost, right? It's like, here, do you want this gas card? Come do what a social worker does, but we're gonna pay you little to nothing to do it. So yeah, that's my thoughts. I'll stop preaching now.
No, you are hitting the marker. And just a reminder for folks on the call, if you can, just graciously please mute yourselves, so because the frequency of sound, and allow space for the panelists to talk. Thank you so much. But I think you hit it on the nail, Gina. Teresa and Rachel and Takisha.
The only thing that I was thinking of saying is making sure that we're valuing people's ideas. And as Regina said, this is no reflection upon my personal experience, but I know other people who have worked with organizations have ideas, and upper people will take those ideas and run with them. Make sure that we're giving credit to the people that have done the work. So if we're talking to our peer workers and they give us an idea to get into the community, make sure that we're in spaces that we are saying, hey, this person said this, our workers are doing this, so that it provides that level for them to move up. It gives them that experience. It gives them things that they can put on their resume for these ideas and these things that they're doing. Because far too often in leadership roles, people take the whole idea of the team and run with it as if it's their own.
And then don't give any credit, and then end up with a grant and they get raises, and the peers or the lower level, because I really don't feel like it's any lower level employees. I feel like we are all on the same level, but like they don't get the raises and they don't get the bonuses and they don't get the benefits. And I feel like when you have a chance, like if you got a grant, like enhance what you offer to people, like improve your employee wellness programs, give them raises, annual raises, get them bonuses, like, you know, take them out to dinner.
Train them to be in leadership roles, give them opportunities, like, and not more peer support training, give them leadership training.
Or
Right.
Gina and Teresa, might I add to that, once you've gotten leadership, right, and this is to namely white directors, are you willing, one, to even give up your seat within that position? And two, would you provide space for me to actually succeed within that position, right, as a director? Do you, like, what opportunities could you create for me, right, to succeed?
Exactly.
So I think that's also the thing too.
Huge, because like positions don't, like a leadership position may not exist, create it.
Yes.
Create the position. Like you are now a coordinator and here is your raise. And yep, everybody on my team is coordinators now.
Listen to me, when I first started, like I was like, oh, okay, so we got to create it. And then the next job I had, they were like linkage to care. And I was like, statewide role, linkage to care coordinator, right? And then they wanted me to build that out. And then I went to UNC, like, you have to like create your own thing. And the people that say no, guess what? There can be 5 no's. There's gonna be a yes. Like somebody believes in not the fact, they believe in what you're doing. They back the work that you stand for. They know who you are as an individual. So like I had a little moment last week about letters behind people's names, and you know how you cannot, some stuff I've learned, you couldn't put it in a book if you wanted to. You know what I mean? And it's good for that. But like I've learned so much from people like Lily and, you know, people that I work with that I didn't know on that spectrum. And like, sometimes I want to be the dumbest person at the table, but when I'm not, I want to be acknowledged as the leader who brought this idea here so we can move forward with it. Like I go up and down the spectrum, but at the same time, like when I bring something and then I watch it created and I got washed out, I didn't understand that research was like until I read a paper and I was like, oh, this is me. So, but just, you know, learning how to be strategic almost in what you share and how you share it, because it's hard to watch your ideas formulate and you have absolutely no credit. And I love my team because they just kind of like, do whatever, Gina, just don't burn it down. And that's what my supervisor is there for in case I do burn it down. So we're good.
Yeah, I try to be the same for my people. Like I said, I don't run our harm reduction program. We like, I get them money so they can run it, right? And like we engage with each other and we capacity build and we just empower and improve and, you know, like try our best to make sure that the opportunities that they have are meaningful and they just don't feel kind of like stuck. And like, sometimes you can't help it. And it's just like, oh, just communicate it, because like, then we can like move you. It's people that I work with that's been held so many positions because it's just like, well, I'm tired of being a prevention specialist. Like, well, what else you want to do? Because we're such a small org, there's not a lot of like leadership opportunities, but we can give you a raise and we can move you to somewhere where you feel more empowered to do the work. And then you still have this other skill. And then when it's time for you to depart, to leave, like you can leave with all the love and all the light and you looking for another opportunity, let me know, because like I know such and such and they hiring, and like let me give you like a leg up in that, because like you are people, like we love you. And like I hate when people be like, the people you work with, not family, like them my people. I'm with my work people more than I'm with my regular people. And them are my people. And then like one more thing, y'all.
Yes, go ahead. Go ahead. I'm loving it.
Like one thing that I really dislike is when people post positions and it's just like, oh, you need like a bachelor's or higher. And I'm just like, yeah, but like people that don't have that, with that lived experience, that grew up in the hood, that grew up around it, that grew up in it, that was immersed in it, like those are people that you need on your team. And you could capacity build, you could build them out, you can empower, like get your people, because like I said, I was an intern. Like I was literally an intern. I felt like I was just this little girl from the hood. I'd never fit in there. And like all the stuff I knew just from hanging with my people, it benefited wellness so much. They was just like, girl, like, no, you got to come on to the team. And I'm like, for real? Like, I'm not even done with my degree yet. They like, nah, just come on the team. And I've been there ever since, because they valued me in a way that I didn't value myself. And a lot of times, like, we need to do that for people. We need to value them and show them that they're important, that their experiences are important, because the world is telling them, like, if you from the hood, you can't be important. You can't be this. And like you can. Like you could be all of that and more than them, because you're probably more valuable than them. They need you. So get your worth. Stop putting BA on everything. BA is BS, nah.
No,
No, but for real, like give other people a chance. Hire the person, like at least interview the person and ask some real down to earth questions. Stop telling people, tell me about yourself. Like, because people don't be knowing about themselves.
right. No, and I think to that also, we know this already, that the way in which we imagine knowledge production is often rooted in white supremacy or white supremacist ideas of logic, and that is inherently violent. And oftentimes we've seen this in most of the professional sector, where education has been a huge barrier, right, and has limited folks within the field. And for me, I'm always working towards, and we used to talk about this in the collaborative last year, right? Like, how do we sort of decenter knowledge production and center lived experiences, right? Because we know that the personal is always political, right? And we should do more work around that. So everything you're saying, that's why I kept throwing my hands up to that. But yes. And I'm gonna throw it back to Elika.
Yeah, I'm definitely hearing everything that y'all are saying, and hearing about making sure to give credit to BIPOC harm reductionists, making sure to create pathways for leadership roles, and then making sure to have like meaningful input, meaningful relationships with people on staff. And I was wondering, are there any other strategies that managers and other leaders can use to support BIPOC staff in their roles and in their positions?
I just got goosebumps from Kelsey's point in the chat. I think that I'll say this. I think that I'm blessed for being a consultant with NASTAD, who is always making sure they are being inclusive or trying to find like ways and means to make sure that they are adding, value to drug use or health. Who would have thought one day there'd be a drug user health team, like a team, like we can say drugs and user and health, and like there's no requirement and then also like having the opportunity to do what we're doing right now, which is sex worker health stuff and building out on a survey collected from them. And like, in my mind, I would love for the sex workers to train us in order to train other people, because, and not give them a gas card, right? Like, just like communities of color or working in Black communities, you tell us, like, I know in Maine, I think that's where she's from, that there's a really underground thing that drug dealers are there to make sure that they're not, like, that they're mixing correctly. Like, it's very underground. I don't think it'll be in a news article anytime soon, but you know, just, I think the more, yeah, I don't want to be the angry Black woman on the panel. I don't want to be that person. And at the same time, like, I feel like Rachel said it earlier, like, if you get a seat at the table, you have to talk about the things for, like, we're the voice for the voiceless, right? So they can hear me now. Like 6 years ago, they wouldn't have heard me at all. So what are the things that I'm able to say and bring light to that we may work together to, like, change? Because they're definitely not listening to the participant right now, like, and they're not at the table. So saying it without being the angry Black woman, Takisha, has been my, like, it's my gray area. We all need to get help on something. Might as well do that.
One thing I've heard and I want to echo is valuing the people in the community who have lived experience. A lot of times we want them because they can get into the community, but we're not going to pay them. We want them, find that the leader of the community, who's that gatekeeper? So what am I going to be able to do for that gatekeeper? At one of our Syringe exchange programs, it's in a primarily African-American neighborhood, not a lot of injection drug use. So that is one of the reasons why I'm pushing for other safer supplies to be there. But we have female condoms, internal condoms. We have condoms. We're doing HIV and Hep C testing there. And there is a lady who is the gatekeeper. She goes out and she talks to the sex workers in the community and says, hey, they over here testing. You need to be over here. You know, of course, there's nothing that we can do for her, but she's doing the work. You know, we just started going into that community, but she's bringing people there and she's helping to build that bridge where people can start to feel more comfortable with my team. But how do we value her? You know, what can we do for her? She's struggling. She's a sex worker as well. She just has everybody staying at her house. You know, and we have to acknowledge the struggle that people are going through, as well as acknowledge the value, because we need them to get our work done. And to pretend like we don't is you know, it's injustice.
Without a gatekeeper or a peer distributor that is actively working with the SSP in that community, we do not meet that community. Like, and how do we honor, like you said, Takisha, the individual that is, because there's always one, and always, well, this has been my experience. They'll like want all the supplies and they'll be like grateful and they're like in charge until people call all night and then they're like, yo, come on, you got to meet her yourself. So because the importance, or like it'll be the one who's doing like the actual overdose, and they get back and tell you, and like it's giving a person that kind of like purpose to be the individual that's the go-between. But how are we honoring and valuing that individual? Because without that individual, like getting into that community is going to be very surface level. And I don't work at the surface. Like we need to dig into the soil and see how we could treat the soil, because the surface is what we've been dealing with for years.
Question. How does the racial justice movement intersect within other movements? And what should harm reduction prioritize as it pertains to mobilizing the health, dignity, and rights of BIPOC harm reductionists?
I don't think there's anything that doesn't overlap or intersect, correct? Like every movement, everything that we work in and around as a harm reductionist, be it at any level, being the director, who is the director of whatever, like I know the organization I worked for, there was like a non-hierarchy. Yes, we had an ED, that our ED was still the one that would still go do like distribution and like work out there, but like there's no movement that's not intersectional, correct? So like if we talk about criminalization, like there's an intersection, right? Now the difference that I think that I know that I've heard in the past, was it 4 years, is like, that's funny that they'll send them to treatment, but I'll go to jail if I tell them that I smoke crack, right? But if I say that I'm doing heroin and I can't stop, you know, then all of a sudden all these resources drop down from the sky, and the person that's smoking crack or doing meth, and they're like, well, we don't know how to engage with them because there's no magic cure, right? Like there's no MAT, or there is, but they haven't like finalized it. So it's almost like, still we are like causing stigma and silo, and it's all just drug use, right? So, but to speak to that point, Takisha, I don't remember when it was, but like my friend's brother got released from jail and sniffed heroin and was dead. Like, and I went off. I was like, who is working in the community that is not hyper focused on syringes? How are we meeting the needs of these individuals? And I'm pretty sure it's somewhere on LinkedIn if I didn't take it down after I did it. But the frustration level of like this could, like, overdose is preventable, right? But it's only preventable if we are actively engaged with the people who are using. And that means everybody doesn't shoot up. Everybody doesn't need a tourniquet and a cotton. Some people need other things, right? Like, and not to even say that a safer snorting kit would have been helpful, but at least we could have presented in the lock zone. But if we're not in those communities, then we're not presenting anything. And I think it takes an extra level of trust to work in those communities, right? Because historically, like, we're not used to people just saying, hey, here, we're gonna give you something. For what? What do you want from me, right? So finding the gatekeeper, and then like, I mean, and yeah, like that gatekeeper, somebody asked me yesterday and they were like, do you offer them anything? And I was like, if I had it, I would, you know, but I haven't. But thinking about how important it is to get in that community, and how do we honor that individual, or have them come to the office and maybe become like a part of the organization. And like, I don't, maybe I talk too much.
Oh, you don't. Like, you speaking like straight facts. Yeah, it's so hard because a lot of times, and I feel like you said it earlier, Regina, or maybe like, I don't know who said it, but one of y'all said it, one of y'all amazing people, that like the funding goes to these big, large organizations. And then like these smaller organizations that are actually out there doing the real work, like the real work, don't get the funds. And so we can't like supplement services. We can't engage with the gatekeeper and make sure that they get a stipend, or like you can't give cash, right? Like you can't give a stipend as a check so they can cash it, or like, or something where it's meaningful. And I remember the Trans Sisters of Color project, and they was going for some grants, and the funder was like, you can't give out cash. And they was like, then we don't want your money. And that, like, that stand that they took was so meaningful, because like these trans women needed cash in hand. They did not need gift cards. They needed cash in hand. There's so many barriers to cashing checks, right? Like, do you have a bank account? Are they gonna take all your money at the corner store? You know, corner stores will nickel and dime you to death. And so like, it's so many barriers that are put in place by the funder, and these barriers don't need to exist. So I guess like, that's what they need to do. They need to remove all these funding barriers, because I feel like they sit in a room and they're like, okay, we have $5 million. So the first thing we need to do is say what they can't do with this money. And it's just like, what? And also, we will not give them the money. We're gonna give this organization with this really nice website with all these these PhDs and all these letters behind all their like higher staff names. And then like maybe they can help the other people out with the money. And like we had an organization in Flint, y'all, I'm gonna call it out. They got, and like we're the only organization in Flint with an SSP that's doing direct work like similar. We're the only harm reduction organization that's focused on harm reduction that has the SSP. They gave this big organization all this money to do opiate, like to do opiate intervention. They never even reached out to us. And when we reached out to them, they was like, oh, that grant money is gone. What you spend it on? Because you ain't need to send me an email to say, hey, we got this money, and so it's just like everything needs to change. Like systematically, everything needs to change. It's like 90% of it is wrong. And they need to get it together and they need to listen to the upset person in the room. I don't say the angry, but like they need to listen to the BIPOC person in the room that's making the space uncomfortable. And they need to sit with that discomfort that they have and realize that they the problem. Like it's not the one that's speaking up in the room that's the problem. Is you the problem. You the one that's deflecting, the one that's like, we don't do that. You the problem. And just sit with that for a little bit and then work through that so you can become not the problem. Because we can move, it's a spectrum. You're either the problem or you're not the problem. Move over here.
I also want to note, Sade, my colleague Sade in the chat said the whole funding system is rooted in white supremacy and patriarchy, just like everything else, and how that plays heavily in how applications are reviewed and how dollars are dispersed. So I just want to throw that out there. And yes, Sade, I agree with you on that.
I wanted to kind of back up what she just said.
Go ahead.
When it comes to like gift cards and money, this is harm reduction. So it's the nice new term that everybody's throwing around because it's the money term, but it's also, how is it harm reduction when I'm telling you, you can only go to Walmart? Or you need to, I'm gonna give you some money. Thank you for coming and doing our survey, but we can't, like you said, we can't give you cash because we don't think that you are responsible enough to do what you're supposed to do with this cash. I don't want you to take my money and buy drugs. So I'm gonna give you this gift card. Or I'm in a rural area and Walmart and Kroger and stores like that aren't readily available to me, but this is all you have to offer me because you can't trust me to give me cash or the incentive that I really need.
What's crazy is that you ready for it to get a little more interesting. So the Walmart gift cards they were giving out here through the health department, you were not allowed to buy cigarettes or beer. So like, imagine how much time that took for you to have to like decide that and speak to somebody and make the card like that. But like, what does that say about how much you honor me? Like, it's so controlled. Like we have to be in so much control. Like, are you kidding me? What, like the first thing I'm buying is a pack of cigarettes. Like, and ooh, I was like, I can't do this. I can't do this. I can't do this. And like, I work through a university. And so Takisha, I know you're aware, like there are a lot of IRB and everything has to be perfect. So I give a lot of grace to that. But like when we are doing things intentionally to make sure you're not buying certain things, I've never seen that as a harm reduction movement or as something that would cause less harm to somebody. So basically what I'm saying is you're valuable enough to go to Walmart and buy some asparagus, but you cannot buy cigarettes. Like, first of all, and gas cards, aren't we good?
They want us to rigorously pursue receipts for people that we give incentives to. So you want us to only give them incentives to places that don't sell cigarettes or alcohol. Then you want us to ask for the receipt when they spend it? Like, what is that? Like, what's that thought process? Like, I'm telling y'all, they be in a room, I'm gonna call it the barrier room. And it's the room to create barriers to all the money that they hand out.
Yes. I'm loving this conversation, and we have 8 minutes left, and I want to throw it over to the audience. This has been good. I know earlier I said that Allison talked about the conference room metaphor at the opening plenary, but I wanted to think of this as a barbecue where we are sitting back, having good drinks, good laughs, good food, and great conversations like this one. So I want to thank y'all for sharing space with us. And do folks have questions? I'm gonna go through the chat and see if there are questions, but if anybody would like to unmute themselves or ask in the chat a question to our lovely panelists, that would be great too, while I go through the chat box. We do have one question for panelists. Can any of the panelists share an example? And this is from Frankie Edwards. Can any of the panelists share an example where a gatekeeper was identified and a relationship was built, which opened up the opportunity to engage a population that would not have been possible without working with the gatekeeper?
So I'll kind of talk about that a little bit in a couple of different ways. In our trans community here in Louisville, it is very difficult to build trust in that community. And there was an event that we had a couple of years ago when I worked for the health department here, that if it wasn't for working with that trans gatekeeper, we would have never been able to get those questions answered that we needed. We wouldn't have been able to really start to offer the testing that's needed in that community. And even now, like trying to recreate that space is somewhat difficult because unfortunately that person passed away, and we're trying to recreate a couple of years later that same thing, and without having someone who is very trusted, especially in a community where there is a lot of stigma involved, it's hard to get back in. And as I said, with the syringe exchange, working with sex workers, when we first started testing in that area, nobody wanted to come to our vehicle. You know, we know what's going on in there. I don't want people to think that I have HIV or I have AIDS. But because this trusted person is going around the community and saying, hey, this is what they're doing, and they have condoms and they have other supplies, it has opened up the community to trusting us to come in and getting those HIV tests, and also talking to us about the other needs that go beyond syringes that they need in that community, so that we can start to work on those new initiatives as well.
Mm-hmm.
I think, oh, I see Monica. I should be quiet for a minute and let her go, just let her go. But I think definitely to speak to Takisha's point, working in the sex worker community and making sure, you know, sex worker health here in North Carolina has been different. You know, it's kind of like added onto and added into the work that we're doing for SSPs, but there's not a lot of money that's allotted for sex workers unless you say you've been trafficked. And a lot of people don't even recognize trafficking if substances or drugs are involved. So, you know, finding that individual that really, really, like, that is my, boy, I never miss direct services more than this panel right now. Cause like that, you know, that there's something to be said about just being able to walk in a community and just allow people to talk. And like, one of my actual counties was where I used to run at. So like just seeing, and it's amazing, like, cause nothing's changed. Like it's still the same landscape, but like asking them, you know, especially there, cause there's not a lot of resources, and you can go in to treat abscess, but they won't touch the substance. So as soon as you feel better, you're ripping out IVs and walking out the door. And I don't blame them, because now I'm dope sick, but you're cleaning my abscess. So yeah, I think the gatekeepers are so important. I'm gonna be quiet.
No. Any other questions for our panelists? Feel free to unmute yourself, or you can put it in the chat.
Monica, you're on mute.
Monica, you're trying to ask a question, or? Oh, no. Are there any other folks that have any questions for our panelists at all? I guess my question would be, what inspires you all to do racial equity work in the South? One, what inspires you, and two, what enrages you?
So I'll go just to get it over with. Say what I need to say. What inspires me is I am so passionate about Black people. I'm passionate about all people, but my people in general. I had an uncle who was an injection drug user for over 30 years. So I know that harm reduction worked for him. I know that the compassion that my mother showed him without even knowing what harm reduction was is what saved his life from dying from addiction. So I'm passionate about saving our people because I know he had no resources when he was in the bowels of his addiction. What enrages me is that sometimes it's so difficult to get those other things that's needed for the population. You know, it's frustrating to constantly have to explain to people that look like me why we didn't have services for them back then and why we are still lacking in some of those same services right now as we're into 2022, but we have services for other people. So I feel like we need to, of course, support all people. But for me as a Black woman, whether it's HIV prevention and understanding how we are always on that disproportionately affected, I feel like if I say that word one more time, I'm gonna go crazy. You know, us as Black people are disproportionately affected to this and disproportionately affected to that. You know, I need us to be proportionally affected and to be winning instead of always on that back end.
I'm technically not in the South. It ain't no technically. I'm not in the South. It ain't technically. I'm in the Midwest. I'm in Michigan. But with that being said, like what inspires me is just like, so I don't know how to put this, but like I grew up and it was very clear from a really young age, like racism was really clear and adamant. And like growing up in like schools, like our school was mostly Black. I had a Black male teacher and people like, I never had a Black male teacher. And I'm like, oh, my science teacher, and not my science, but my math teacher was Black or whatever. But like seeing that and then seeing the inequities that they were teaching us, because we had Black teachers, they taught us a lot about the inequities in society. And I remember like being asked, like, what do you want to do for a living? And I remember one teacher was like, oh, well, that's more of a white job. And it was just like, what? And like, so little stuff like that. And just seeing like how ingrained and how internalized racism can be, it just made me like want to point it out. Like, I just want to point it out. Like, oh, what you said, that's problematic. And they like, how is it problematic? And or say like, oh, that's tied to white colonialism. And they like, it's not. And I'm like, everything is tied to white colonialism. Y'all, I be in my anime little nerd groups arguing about white supremacy. It's bad. Like, I be like, Musa is colorist. Like, and so, you know, like that, like just seeing that and then being from Flint, the city of Flint, and all the things that we went through and go through, like, it's just empowering. And then you get to have a direct impact with your people. Like, these my people. Like, I know your mama, I know your granny, you know, I know your cousin. Like, I know, you know, such and such, like that kind of impact. And then what enrages me, like white supremacy enrages me. Like white rage enrages me, because white rage is what moved my family from Arkansas to Kansas City, because we own farmland that they would not leave alone. And so my family had to sell their land, they 250 acres of farmland, and buy a couple of houses in Kansas City to get away from it. They had to flee it, you know? And so white rage, like, is like, it enrages me. It's just like, why do you get to do that? Why do you get to be that? And white complacency enrages me. Like, people that sit back and like, I'm not racist. Like, yeah, you are. Like, we all have that in us. I'm a cis hetero woman. I'm homophobic and I'm transphobic. It's in there, but I work daily. When I when that thought pop up, I'm like, oh, the fuck, like, oh, we're not doing that.
Right.
Like, you gotta challenge yourself to not be what was ingrained in you, and people don't do that, and that ticks me off. Like, work on yourself.
Let's do some cultural humility, right? Like, as soon as we can address the fact that we all have biases, even as Black women, or however we identify Black, whatever, like, there's biases that I didn't know I have until they come up, right? But if I act like I'm just like, no, I love everybody, that's not real. Like, that shit started when I was younger with my mom telling me what it was. And I carried that belief system. So I have to unbelieve things in order for me to be able to do this work. Oh, NASTAD does not play with the time, honey. We're done.
I'm gonna kick it back. Thank y'all so much. I really appreciated this space and this conversation, and I'm gonna actually kick it back over to Elika.
Yeah, just echo everything. Thank you all so much for being here for this panel. And it's been really nice to have this space and conversation with you all, and looking forward to seeing you at the next session. Thank you all.